Welcome to our HSTP meeting today. I'm going to start with roll call, and then anyone whose name I don't call, we will go around the room and see who's here. So let me know if you're here. Shelly Entrikin.
Here.
Barb Long. Doug Manick. Audra Miles. Here. Joe Coffin.
Here.
Craig Boynton.
Here.
Hannah Fuchs. David Luters.
Here.
Mary Patton. See that you're here. You're muted, but I saw that you said that, so you're good. Heather Boucher. Tracy Dowell. Renee Razzo. Vivian Hageman. Max Schneider. Tyler Rogers. Troy Maxwell. Don Harper. Thane Hunt. And Jody Scott. There you go. Angel Marinich. Shamra Robinson. Kylie Rathman.
Here.
Chris Mitchell. Connie Sheely.
Here.
Jim Bremner.
Here.
And Greg Cassidy. All right. So we don't have a quorum for the whole group, but we do have an urban area subcommittee quorum. So we could potentially, if we wanted to, approve the minutes that way. So I'll catch that in agenda item 3. So who else? Is there anyone here? I didn't call their name. Melissa Orwell with IDOT. Oh, and I've got Jared Arthur online. He told me before his mic wasn't working. I've got Gabe here. Oh, we've got Lonnie Baker. Remind me where you're from, Lonnie. Looks like you're not muted, but we can't hear you. There she is. Stonehays Hill in Galesburg. Okay, thank you. All right, and I think that covers it. Okay, so do we have any public comment today? Moving on to the approval of the minutes. So like I said, we have a quorum for the urban area subcommittee. So if everyone is okay with just the urban area folks approving the minutes on behalf of everyone's, we could do that. Is there anyone opposed? All right. So do we have any comments? Or actually, I need a motion and a second from just the urban folks.
I'll motion.
All right, so we have Kylie was first, and then Thane is second. All right, so now do we have any comments about the minutes? Okay. Hearing none, I'll do a roll call vote. Just going down my list. So Don Harper, just yes or no for the minutes. Yeah. Thane Hunt.
Yes.
Kylie Rathman.
Yes.
Connie Sheely online.
Yes.
All right. And Jim Bremner.
Yes.
All right. The minutes have passed, and I see we've got Heather on the phone, so I'll add you to my list. Excellent. Moving right along. So we'll do the provider and agency updates, and I'll just go with how we're sitting in the room. So just give any sort of update you would like to share with the group. So we'll start with Joe. All right.
We are still in the middle of our RFP for dispatch software. We've narrowed it down to 2 firms, so we'll be reviewing those and having presentations. So we'll hopefully have software in the next 6 months.
That's great. Melissa, you have anything to share?
So the CBP application award letters were posted in Black Hat in January. We're set to begin building vehicles in July, and more information will be coming soon about the anticipated delivery timelines for the different vehicle types. As always, minivans are pretty quick to build, and the larger vehicles do take longer because they're a more complex process. We'll be sending updates throughout the build process as well. We're issuing contracts for the vehicles again, and those agreements will be sent to your agencies as we approach delivery for the first vehicles. For non-for-profit partners, your GATA profiles must be in good standing. Updated ICQ for fiscal year 24. And then, let's see, the next CBP application will likely be in 2025 we're looking at now because we need to have our funding pots fill back up since vehicle costs are twice what they were in 2021. So once we're closer to that time, we'll hold informational sessions as we have in the past.
Thank you. Moving on to Audra.
Other than we have our DOPE and 5311 applications submitted.
Anything?
No, this time.
Not really. Like, we still have our survey open for our active transportation plan. That is closing April 8th, so there's still a couple days left.
Was that emailed to people?
Some people got it. I think most folks are on our email list, but I will send it just to make sure.
Okay, I don't remember seeing it.
I might have not added you since then, but I'll send it on.
Okay.
And now it's your turn.
I still have the same issues as before. Transportation, getting people to, qualified people to jobs that are on the outskirts of town or outside of bus hours.
Okay, Jim.
Washington Township, in the last 6 weeks, I'd say we have 3 new riders that we signed up, which is encouraging. Gives us over 40 people now that are registered to ride, and that's going well. No complaints. Ridership is steady. It dropped off a little bit with the cold winter months and still hasn't come back to total fruition yet, but it'll get there.
Excellent. How about Dawn? Okay, so I'm going to start online. I'll just go with my list here. So Connie, would you like to share anything with us?
Not right at this time, but I would like to say I'm really happy to hear about the increased ridership in Washington Township. That really warms my heart. I am all for the outer county areas having the same access to transit services as everyone else in the inner city, and I think this is a wonderful thing, and thank you.
All right, moving on to Heather Boucher.
I don't have any updates right now. Thank you.
All right, how about Shelley Entrikin?
I have no updates, thank you.
Okay, and Jared, do you have anything? I think you said your mic wasn't working. There we go. You're right ahead of me. Nothing to report. We just lost Lonnie, so maybe she'll jump back on. Mary Patton, do you have anything for us?
Nothing today, thank you.
We'll end with Dave Luters.
No updates today.
Breezing through. All right, so the next thing we've got is the APTA recommended practices for naloxone or Narcan for transit agencies. Oh, Lonnie's back. Let's see if she can. Hey, Lonnie, do you have anything to share? Is your audio working? Okay, we can follow up afterward if you need to. And you can always send a message too. Okay, so we'll move to the next item. Let me share my screen here. Which one was it? Okay. So, there we go. All right, so The reason I'm talking about this, and I have to preface this by saying that I am not an expert in this subject, but I just read the document that the American Public Transportation Association created, and it's pretty new. They just released it in January. So in case this applies to everyone, or if not, just a learning opportunity. So these are just recommended practices. So there's no strict rules here. There's no laws related to what a transit agency has to do involving this. But this is just for your information if you choose to do something along these lines of this topic. So I've got this document right here. It's just a picture of it online. So it's about 11 pages. It's a pretty easy read if you are more interested in this. But the key purpose is just to provide recommendations about occupational exposure to fentanyl, to recognize fentanyl use, and to offer considerations for issuing naloxone or Narcan to employees and what that could look like in a transit agency or a similar agency that transports people. Okay, so just an introduction about fentanyl. So it is a very powerful synthetic opioid that is 50 to 100 times more potent than morphine. You just need a very small amount that could cause negative health effects. So about 5 grains of salt worth, very small. There are 42 known illicitly manufactured types of fentanyl on the market. So there's a lot going around to be aware of. This is not brand new. Unfortunately, it's in the past several years come up. But we're talking about it now because drug use and overdose deaths in the U.S. have reached record levels during COVID. So that's something that transit agencies are starting to talk about more. So there is growing concern about potential exposure to transit operators and staff. And there's documented fentanyl use and overdoses occurring in transit vehicles and stations. And this is nationwide. So it obviously varies depending on the area, but it does happen. So some notes about what kind of the exposure types. So fentanyl does not linger in secondhand smoke, and it is effectively impossible to overdose from just touching it. You would have to like put it in your mouth, ingest it somehow to have that type of exposure. But it's understandable if folks are uncomfortable with the smoke. So in terms of recognizing fentanyl use, so the overdose symptoms include small pupils, falling asleep or losing consciousness, cold and or clammy skin. There is more than that, but that's just a list, just a part of the list. And then, so there's 2 names. Naloxone is the main name, but then the brand name is Narcan, and this is the life-saving medication. So it could help someone having an overdose. It can specifically restore the normal breathing within just a few minutes. So it does save people's lives. The FDA approved it in March 2023. So it is safe to use, and you don't need a prescription. You can buy it over the counter. And so if there is potential overdose that you see based on these symptoms, the recommendations in this report is to call 911, ask for medical help. It as just level 1, that's the first thing. And it is safe to use on people of all ages. And an interesting note is it will not cause harm if you give it to someone who's not actually having an overdose. If it appears that they might be, and they're given Narcan, then it will not harm them. Okay, so now we've reached the transit portion and what this report documents. So basically, if you're thinking of putting some sort of program into place to allow employees to use Narcan or to have it on them, these are the recommendations that the American Public Transportation Association, APTA, has. So I'll go through these kind of broadly, but establishing and managing a program, training personnel, purchasing, storing, and maintaining a supply, administering naloxone, and reporting. Okay, so establishing and managing a program, this is I think the densest slide, but so their recommendations is to identify a project coordinator, someone in charge who folks can go to if they have questions, to definitely collaborate with public health and first responders, because people already are doing this kind of work in the community, so you don't have to redo anything that's being done, which is nice. And then identify the type of personnel designated to carry naloxone. So would it only be security folks, transit operators, whatever makes sense in your organization? And then you would develop policies and procedures for things like training, safety, and definitely step-by-step instructions for those who end up being qualified to use it. And then throughout the process, APTA recommends to regularly seek feedback from the community partners. So always just use that base of information. Okay, so in terms of training, I think this actually is the very last slide. So training is, again, they recommend to explore programs that already exist. If you can reuse things that you don't have to do extra work, that can still apply in the transit realm, then that is ideal. If there are new programs needed, you can add on to that. Things to consider that they listed are laws and regulations, drug abuse and addiction information, and just general CPR training. And then maintaining a supply. Interestingly, so this medication should not be exposed to extreme heat or cold, meaning that it shouldn't be stored in vehicles. This is obviously mostly relevant in the winter and the summer, but you never know when it'll drop to colder temperatures in other seasons. So that's their recommendation, is not store it in vehicles. And create an inspection schedule just to make sure that it doesn't expire and you don't have expired ones on hand. And then if you do, understand the disposal requirements. So that is what I got from reading this document. If you want any more information, they have it on here. But they worked with folks from around the country in their security and emergency management working group. So these are people who are very knowledgeable about the subject. And I'll leave it there and I'll open it up to comment. I know Jim has something.
Yeah, I wanted to add something. I've been to a couple of different things on this and have worked with some of the people around Peoria on this, and that as it's stated, and I want to reinforce this, that if there is an opportunity to administer to someone with the Narcan, that it won't hurt them if the symptoms you think they're suffering from an overdose, go ahead and administer it, because it's not going to hurt. Okay, it's only going to react with the fentanyl and other drugs that it's intended to. So don't be afraid to administer it. It's a real simple. It's just a nasal spray kind of thing. And this Narcan is available locally through Terillium Place, which is part of Carl Clinic. It's free, so you can get as many kits as you need for your neighborhood, for a health group that might be in your locale. So, and Terillium Place is around here. It was formerly the Tazwood Services for Mental Health is part of Terillium Place. So, in our area here, that's kind of the way that works. I had also asked Rima if I could say something that, addiction is a family disease. It affects everybody in the family, whether you're a parent, a sibling, a grandparent, whatever. And there are a couple of self-help groups here in town that can help parents and others. One is called Al-Anon, which can address family issues. And I have always thought that Al-Anon was more of a partner thing, a spousal or partner type of one spouse is trying to help the other one who's got an addiction issue, but they also work with families. Another group that I'm very familiar with is called Families Anonymous, and they meet here in Peoria, and that is primarily for parents who are experiencing addiction in their children, no matter what age their children may be. They may be in high school, they may be out of school, they may be out living on their own. But as I said, it's a family disease. That meets here in Peoria at United Presbyterian Church on Tuesday nights, but I get more information about that. But it's free. It's a chance for parents to share what's working in their families and what's not. And it's important to realize, for parents to realize that you're not alone in this aspect. There's a lot of people out there that have got this issue. It's a tough issue, and it's a safe environment to come and share what's working for you. Totally anonymous. However, if you want more information about Families Anonymous, you can go ahead and capture my email from this meeting, Jim Bremner. You can go ahead and contact me, and I'll send you the information about it. We can talk about it if you like. It'll be confidential, so feel free to do that if you want to reach out.
Yeah, and I've got the sheet that Jim gave me. I'll scan it and email it out too.
Yeah, this is Mary. I'm kind of confused. I thought this was to help prevent. Bus drivers, or not, the van drivers are the ones that would probably administer it. And yet this Narcan is not to be stored in the vehicles. Could you explain how the drivers would get it while something's happening while they're on the route if they don't have it in the van? I'm really kind of confused.
This is staying with Ethics for Access. So Narcan is sensitive to extreme heats and extreme colds. When they say it's not supposed to be stored in a vehicle, they mean when the vehicle is parked and not running. So if there was a kit that the driver took with them, or if it was on a keychain attached to the keys, so that it was stored in the building that's climate controlled and goes from the building to the car, it would be fine for them to keep with them. I've also been told by other people during Narcan trainings that while it's not ideal to store it in a car, that it is still usable. So I think it's to get the most effect, you don't want to expose it to hot or cold. Another organization that does great stuff that will actually come out and do training for your agencies is Jolt Harm Reduction. And they'll also, last I knew, they were also providing free Narcan kits as well as you needed them. And they have needle drops. But yes, they are able to take it with them while the vehicle's running, but we don't want to leave it in a vehicle when the vehicle is turned off without the climate control on.
Okay, thank you.
Do we have any other questions or comments? Okay. Moving on. So I'm going to keep sharing my screen. Okay, I will move on to my report. So, yes, like, actually I'm going to jump. I'll start with this one. Okay, so if you've been on this committee for some time, then you remember me talking about Section 5310 funds. And these are Federal Transit Administration funds that Tri-County gets because we have over 250,000 in population in our urbanized area. So these only apply to our Peoria Pekin urbanized area. And they are to increase the mobility options for seniors and people with disabilities. So knowing that, we are ready to release, getting ready to release our call for projects. As you can see here, it's April 17th. So we haven't released it yet, but we have a kind of a draft version. And this would allow public agencies, including nonprofits, to be able to apply for these funds. This year we have, let me find the number. 175,040 available in the Section 5310 pool for any urban projects. And I've given a whole presentation about this, so I won't go in depth about what those are, and I will send a follow-up email about this, but these are the available projects. I will send all this information. We're doing it a little bit differently this year, but if anyone just wants to apply for Section 5310, then it will be very similar. So for us, it's different because we're combining other calls for projects for other grants and funding programs, just because internally it's a lot of administrative work to split these up. We've always split these up in Tri-County, but these are the other ones just for your information. Carbon reduction program, it's a pool of funding relating to reducing carbon in road projects. We've got surface transportation block grants, also road projects, construction, and transportation alternative set aside, which is bike focused. So if you don't apply to any of the other three, it doesn't matter. But I want to show this all to you since we've been putting together documentation for 5310 that's rolled into this whole thing. So it sounds more daunting than it is, but we essentially, especially if you, hold on, let me fix my screen sharing here. So I switched application. 1 minute. Okay, so if you've applied for Section 5310 in the past, then it was a Word document that had several questions. Those same questions are just on a Google form now. So hopefully it'll be easier. Again, especially if you're only applying for 5310 and none of the other programs. So I'm going to give you a quick run through of the application. And honestly, 5310 is the easiest one on here because it is the least funding. So we won't make you work as hard, hopefully, to try and get the money.
Quick question.
Yeah.
The date you said is April 17th. That's when it's opening, or
Yes.
they have to be in by then?
That's when it's opening, and it's due on June 8th. So you've got a chunk of time. And you have even more time now since we're releasing this Google form just to make sure there aren't any bugs before we officially release it. So feel free to look through it. And I'm going to click through it right now again. This just explains this is combining one single application for all those programs I mentioned. And I'll show you if you just want to apply for 5310, you will put in general questions that apply to all of them. So your name, type of project, agency. Moving on to the next section, you explain what type of project it is. We put all of the potential options. So this is a long list, but they might not apply to you. So there's this transit section in the middle. You could say, I want to have transit expansion and stop improvements, for example, as my project. You list the amount of funds that you have. And then at the very bottom here, the way that this Google form is split up, it allows you to jump around to different applications. So you say, yes, I'm here for 5310. Then you go next. And 5310 is only one page, so it's all the same questions that we had in the past. Next. And you're done. So it's very straightforward. There's no changes in terms of the questions, just in terms of the format. And then if you happen to want to apply for any of those other programs, you can. But if not, just click, nope, I'm done. And that's it. So I will send this in my follow-up email. Again, it does only apply to the urban folks, just since that's the way that the funding is structured. So I can't change that.
Can you set up the grant applications for rural?
I would love to. But yeah, I just wanted to introduce that is coming very soon, and feel free to study to be able to apply by June. And you can ask me any questions leading up to that. All right. So the next thing I've got is, as Gabe said, the last day of the survey. And I'll open it up to show you what I'm talking about. So this is our active transportation plan survey. It closes on April 8th. And this is also, unfortunately, it doesn't apply to the whole region, but I wanted to mention it. Peoria, Tazewell, and Woodford counties. So we're just asking details about how often do you use certain forms of transportation. When we say active, we're referring to walking, biking, and public transit, basically non-cars. And we're going to write a plan about this and hopefully make the environment better for folks who walk, bike, and use public transit. So I will send this to anyone who does not have it. I'll send it to everyone. And if you haven't filled it out, you have that opportunity. And the last thing I have is, I think I mentioned this last time, but more surveys. We're going to close this one soon, and then over the summer, so probably maybe around the time of the next HSTP meeting, or maybe a little bit after, I will ask you for help distributing the 4 surveys that we've done in the past for HSTP. So that's for the community at large, existing transit riders, and that's for urban and rural, agencies, and transit providers. So those last 2 are internal, just someone from the one agency fills it out, someone from the provider fills it out. And then we will keep that data and look at similarities among all of those groups and see what, hopefully we can make anything better. And that is my whole coordinator report. Does anyone have any questions or comments on any of those?
I have a comment about bicycles.
Mm-hmm.
I don't know who needs to hear it, and maybe people think I'm crazy, but when I'm sharing a road with vehicle traffic on a bicycle, I'm not going to travel in the same direction as the traffic. I want to be going against it so I can see them coming if they're on their phone or drunk or whatever, and they're coming over in the bike area, then I can see it and get out of the way. But if they're coming up behind me, then what are you gonna do? Just get run over.
Yeah, that's scary. There's definitely roads that if you ride in the middle, and they might say share the road, it still feels unsafe to ride in the middle. Any other comments? I'll ask one last time. And actually, I will move on to other, which is my same question. Does anyone have any other?
Were there any results of the people that were riding around on the bus checking the routes and things like that?
So that was Kefra. He couldn't be here today. He's got a different meeting. But he sadly is leaving us in April because he has to go to grad school in June. I'm pushing away too soon. He's leaving us in June. But he's making a report about that.
Okay. And
So,
will we all have access to that?
We'll share it with you guys once we have it. The next one is June. Let's see. The first Tuesday, June 4th.
Oh, you missed.
Okay.
I would have a presentation. Be great.
Well, he's needed. Okay. Well, that is the very last thing on the agenda. So if we have nothing else, then we will adjourn. It's at 12:37 p.m. Thanks everyone for coming and logging in.
The survey is asking about how people get around. Has that been distributed to the public?
Yes. Yeah, yes, we've done it. Let's see. Our social media, we contacted some of our
It's
local
a small mess,
community groups that we know about. But I mean, we haven't hit everyone. I'm sure that there are gaps.
Has there been a good
It's like,
turn
last
in?
time I checked, we 170 people responded.
What were you expecting?
Well, I really didn't have a high bar, so it's like I was happy to get I was surprised with what we got. So.
I was wondering, is that in a format where my applicants that come in that don't have cars? And
Yeah, what was it? So it's a Google form sheet. So I can, and we also have we made a paper copy. So I can also email that to you, and you can print out some copies and have them on your desk.
I'm just trying to think of a way that I could get that dispersed to all of the applicants. I mean, our office sees lots of applicants, which I would sadly say over half of them are car driving people. I'd like to get that.
Thank you.
Yeah, we can
Figure out
as your email. So
Yes.
I don't know if I should just give it to them in their packet as they're leaving and say, hey, or just make them do it while they're there in the office.
if they're already there, they might as well just fill it out.
Yeah.
Because